Hello guys, welcome to the 2018-2019 cohort PTA program. Forgive me for my weird sounding voice. I have a cold today, so you're going to have to listen to that for the entire orientation PowerPoint. Sorry about that. Anyway, we used to read the program handbook and the student handbook for NWAC and all that stuff during orientation. But I am hoping that this will make this whole process a little more user-friendly. Giving you a PowerPoint to view beforehand will really shorten the amount of time that we have to spend in orientation going over all the tons of rules that we have to abide by while we're in the program. So just viewing this PowerPoint and taking the quiz that was in that email that I sent you is not enough detail. You definitely need to read the handbooks from beginning to end, because those are the rules that you will be governed by, and they'll tell you all the policy and procedures and practices that we're going to expect for you guys to know so you can follow them. And you will actually utilize those or access those through the Trajexis system, which we will sign up for on orientation day. And so all of those policy and procedure manuals will be inside there. And like I said, we're going to go over some of the big ticket items in this PowerPoint, and then certainly you need to take the quiz that I sent in the email, and we should be good to go. Okay, that Trajexis system that I was talking about, these are the handbooks that are inside the Documents tab in your section, and we will go through this whole system so you'll be familiar. But of course you have the PTA Program Student Handbook, which are the rules and regulations for the program specifically. The HP Student Handbook, which is the Health Professions Student Handbook that all health profession students have to follow. The clinic manual is in there. This won't be really significant to you until you start attending clinical rotations in the fall semester, but we will go over that in that class in the fall. Your State Practice Act should be extremely important to you. It is what you're going to be governed by once you graduate from the program and pass your board examination and begin practicing as a PTA. There are rules and regulations that we have to practice. The State Practice Act and the Rules and Regs Guide will detail all the things that you are and are not allowed to do in the state of Arkansas. Every state does have different rules for the most part, so if you are going to practice in another state, you do need to find that State Practice Act and make sure that you're following those rules and regs too. Then you have the Standards of Ethical Conduct and Values-Based Behaviors. Those are from the Arkansas State Board APTA division. So it's our association. It's like our national association. There's some standards of conduct that we have to, will be governed by. Of course, if we have a values-based behavior and a standards of conduct that we have to abide by while we're in our profession, then of course you would have to abide by those while you're in the program. So we do have a set of standards. It's called a professional development plan that pretty much follows the things that you'll be expected to do when you're actually working. And that is another part of your successful completion of the program. So not only do you have to understand the material and you have to get the grades that are required, you also will be graded on your professionalism and your conduct. To say that, here are some goals for the program. These are the overall goals for the entire program. We want to prepare entry-level PTAs to demonstrate and apply intra and interprofessional collaborative practices as part of the healthcare team, as indicated by the student outcomes. And what does that really mean? We want you to play nice with others. We want you to be able to work with nurses and doctors and respiratory therapists and family members and occupational therapists and speech therapists and everybody that you're going to come across. Be able to understand what everybody's talking about, speak intelligently, treat intelligently, pick the right interventions, and work ethically and legally. The other goal, prepare you to pass the NPTE, which is your state licensure exam. Let's face it, if you go through all of this work and you get there and you can't pass this test, it really does you no good because you cannot work. So of course our goal is to make sure that everybody passes this test to the best of our ability. We do have a 17-year pass rate for this board exam, so we're hoping to continue that, fingers crossed. And just news for you guys, If your class passes the exam at 100% pass rate, that will be 20 years for the program total. So we're getting close. Last thing, to maintain PTA program accreditation by CAPTE, the Commission on Accreditation in Physical Therapy Education. Every PT and PTA program in the United States has to abide by the rules and regulations that CAPTE lays out for us. They tell us what we can and cannot teach, or what we have to and what we cannot teach. And they have a lot of other rules and regulations to follow. We just went through our CAPTE accreditation this year, and we'll have the final notice of what all is going to go on in that report in October. So you guys will be part of that. We'll let you see what they're saying about everything. So those are our goals. That's what we hope to accomplish here at NWACC. Your student outcomes, this is what you're going to accomplish. This actually directly follows your grading tool for your clinical internships. Of course, big, huge, important part, safety. Are you safe? Do you make sure your patients are safe? Are you choosing the safe interventions? Clinical behaviors, again, kind of part of that ethical behavior, legal behavior. Are you accountable? Are you billing like you should, doing the things that you should for your employer and your patient? Cultural competence, in other words, are you treating everybody the same regardless of your beliefs or their religion or their sexual orientation or anything along those lines, right? Every patient deserves the same treatment. Communication, can you communicate with all different types of people from all different walks of life? Self-assessment and lifelong learning. This is part of that professional development plan and the service learning hours that you have to perform while you're in the program. Do you, can you adequately self-assess? This is hugely important in this profession because you work under the license of a physical therapist. And if you are given a patient that's over your head, or somebody that you are not, you don't feel, or you are not educated enough to deal with, it is your job to tell the physical therapist that you don't feel adequate in treating this patient right now. And this is not a judgment call at your level of education. I've been in the field since '98, and if somebody tried to hand me a pediatric patient, I would do a lot of questioning prior to agreeing to take this patient on, because I have never treated a pediatric patient in my entire career. Doesn't mean I'm not smart. It just means that I don't have any expertise in that area, and I certainly need to be able to judge that and say, hey, this is not my area of expertise. I can treat, but I need somebody here. Or just say, you know what, I'm not qualified to do this. You're going to need to find a therapist that has this information somewhere else. Clinical problem solving, of course. You have to be able to critically think at time of intervention. That's very important. That's a hard task for students to grasp sometimes. We have 10 seconds sometimes to make a decision about what our patient's going to do. During that 10 seconds, you have to make a good judgment. And then, of course, you can see the next couple are all interventions, all the things that you'll be taught. In other words, all the things that you can do for our patients to get them better. Documentation, that's hugely important in this career. You have to document correctly to protect yourself and your patient legally. Also, documentation is how they get reimbursed. So you don't want the patient to end up being stuck with the bill because you don't document correctly and their insurance turns it down. So that's a big deal as well. And then resource management. How do you use the people in your facility, like your aides, your PT techs, nurse aides, things like that. Okay, so this is what we're going to expect you to do in the program. Of course, you can see that a lot of these are like the outcomes that we just went over. Perform in a safe manner that minimizes risk to patients, self, and others. Safety will be a big, big push in the program. You'll be graded hard on it. There's no room for error in several of the things that we do. So those are the standards that you'll be kept to. You are choosing a profession, medical profession, where you're not allowed to make some mistakes. And I always give students this example is if you go to have brain surgery and the doctor's supposed to remove a tumor on the right side of your brain, and by accident he goes in there and takes some material out of the left side of your brain. Well, that's never okay. He can't make that mistake one time in his whole career, right, without risking losing his career. So in that instance, he's got to be perfect. He can never take the wrong thing out. And you're held to that same standard. You can never put a patient in danger. You have to hold their safety at the highest regard all times. So you will have to do that while you're in the program. Number 2, we've talked about demonstrate professional, ethical, and moral behaviors. Again, no matter who you're treating or how you feel about how they live their lives or do not. Adheres to established legal standards, standards of the profession, proper support personnel, and again, the State Practice Act and the rules and regs outline all of those. We'll go over all of that throughout the program. We kind of already touched on number 4, providing services without bias. Utilize research so you're making the most current practices. We have to have several hours of continuing education every 2 years. And this is to make sure that we remain current in all the technology and problem-solving abilities that are out there. Do you demonstrate clinical problem-solving skills when determine a change in patient status, new data collection, and need for modification? Remember, I touched earlier about the fact that you practiced under PT's license, under a PT plan of care is what it's called. One of your largest job responsibilities is being with the patient every day and deciding when that plan of care needs to be altered. So you will have to go back to the PT and say, hey, here's the data collection I've made lately. Here's the patient changes that have happened in the last couple weeks. These are some things that we might need to change. And you'll consult with that PT, and the PT will write a new plan of care. But you're the one that's with the patient every day. So if you don't notice those changes because your education isn't as intact as it needs to be, then a lot of stuff will get missed because the PT is not with the patient every day. You are. And then, of course, we talked about documentation, which we don't need to talk about again. Okay, so here's the start of some of the rules. And again, like I said, I only put the really, really big ones in here. There's a lot more that we'll need to go over. You definitely have to read your entire handbook. But let's start with this professional behavior, of course. So it's different. It's different than getting a history degree or an English degree or anything like that. When you get out of this program, you will be governed legally by your legal and ethical behavior. Not following those rules will or could get your license revoked. In addition to monetary fines, jail time, all sorts of stuff, right? So there's codes, there's rules that we have to follow. Therefore, there's rules that we have to follow in here. So not only do you have to complete each course with a C, which is a 77, as you probably know from Kines, and you have to receive a passing score on the PDP. That's the professionalism part of this. If you get a grade less than a C, or you do not pass the professionalism part of the program, you are dismissed from the program subject to your right of appeal. You are only allowed 2 unexcused absences per semester. Excused absences, we'll try to work around that, but an excused absence, of course, is something that you've talked to us beforehand, or you call us that morning and say, I'm sick, or my child's sick, or I just got in a car accident, or anything like that. An unexcused absence is something you don't discuss with us, and you can only do that twice each semester. Let's see, where else are we? The Health Professions Division Student Handbook. Academic failure policy is in effect. You will need to read that. It's going to tell you and outline the appeals process, how many days, where you get the forms from, all of that. It is new this year, so if you've looked at it before and you think you have it, you might want to revisit it because you will need to look at it again. It's a different timeline and a different set of procedures. If you do get dismissed and you appeal and you win that appeal and you're put back in the program, then anything that you missed will be, like clinical information that you missed will be made up at the discretion of your instructor and the clinical side. If you are dismissed and you're in the appeals process, you still come to class, you do everything like normal. The only thing you can't do is actually go to clinical and treat patients. So hopefully this won't matter because none of us will be in that process, but I need to tell you just in case. Okay, as far as lab practical examinations are concerned, and there's quite a few of these in the program. So I'm thinking there's probably about 10 to 13 of these a semester. And these are some of the rules that you have to abide by when taking these exams, okay? Like we said earlier, 77 is the lowest passing grade, so you have to pass each lab practical with a 77% without what we call a critical error. We'll talk more about that later. All lab practical examinations, including all final lab practical examinations, have to be passed with a 77%. If you do not, you are allowed one retake. So you usually retake that same day. If your instructor deems that the information that you are missing is too vast to retake on the same day, then we will give you up to a week to retake that exam. So if you fail lab practical, you can retake it one time. If you fail that retake, then you will be dismissed from the program subject to your right of appeal. If you pass that retake, then you are readmitted in normal status and there's nothing to do. Again, I told you before on the other slide, if you are in the appeals process, you continue to attend all classroom and laboratory information and lectures. The only thing you cannot do is go into the clinic and do your clinical internships. So here's the big rule. People are always confused on this, so please pay attention. Students may only be considered for readmission twice per semester for failed lab practical exam. That means if you take a lab practical and you fail it, and then you fail the retake and you are dismissed, that's one. If you take another lab practical during that semester, you fail it, and you fail the retake, that's two. That's it. You cannot fail a third. We do this because the students historically who have done that, mainly in the fall semester, do not make it during the spring semester. It's a tremendous waste of time and money for you if you're not going to be successful, and we certainly don't want to waste anybody's time or money. So the policy is in place for you to only have 2 reconsiderations for readmission per semester. And again, if you pass the retake, then it never counts as one. So if you have a failure on the original test and then you go to take the retake and you pass it, you don't have one of those 2 attempts that you get. So you're good to go and you still have your 2 attempts intact. It is only when you fail the lab practical and its retake exam that we add one of those 2 that you're allowed to have each semester. You have plenty of time for laboratory practice in class to get the material good enough for you to practice outside of class. But that being said, the key point of that is for you to practice outside of class. You'll be able to do the techniques and the interventions once or twice with us while we're present there in the classroom. And certainly how many times you have to practice it outside of that differ per student, but I'd say an average of 10 to 25 times. You have to practice each skill 10 to 25 times. Historically, they say that it takes something like 170 times to make something a habit. So since you realistically cannot do this 170 times for each intervention because there's just not enough time in the day, you definitely need to practice it as many times as you can. I'd say the average success rate for a student would be between 10 and 20, 10 and 15 times, depending on the skill. So certainly you'll have plenty of time to be in class with us and to get feedback, but a lot of that time that you practice is going to be outside of class time on nights and weekends, and you're going to be relying on feedback of your students, your fellow students, to kind of run you through whether or not you're doing those things correctly. I definitely recommend that you guys support each other. Close-knit groups are always more successful. The grades are always higher when the class gets along. So hopefully, despite the fact that there's going to be 18 different personalities in the classroom, you guys can find a way to make sure that you stay close and support each other from beginning to end, because you will need it. You guys will struggle. You will get frustrated. You will be tired. And if you guys will help lift each other up and increase each other's education through practice and good feedback for one another, the year will just be so much better for you and for us, frankly. Some of the other rules for the lab practical. Usually you have to do some documentation that is either done before or after the lab practical. There are certain times for those things to happen, so you're allowed a certain amount of time in the documentation room, and you're allowed a certain amount of time in the treatment room. You do have to follow those rules, those times. If we do walk into that documentation room and you're documenting past the time that you were allowed, you will receive a 0 for that documentation and rationale, and you will be asked to leave that room. Usually a 0 on rationale will cost you the test, will bring your grade below a 77, so you definitely want to follow the rules. That's in place because it's not fair if you get 25 minutes to document and somebody else gets 15, right? Then you got an advantage on the test, and that's not fair. So we hold the exact same standards for all students. This is a big one, which is why it's bolded, and we take this very serious because academic dishonesty is absolutely not accepted at this college. Students who have taken practical exams are not to return to an area where the students that are still waiting to test. They cannot contact another student that has not tested by text, by phone, nothing. In other words, you cannot talk to somebody who has not taken a lab practical if you have taken it. It's just a couple of hours. You guys can wait. So if we are walking down the hallway and we see you talking to a student that is not tested and you have tested, you will be written up for that behavior. If you're written up for that behavior 3 times in a semester, you are dismissed from the program. So failure to abide by this policy is an automatic dismissal. You cannot, and you can say, hey, all we were doing was talking about lunch, or all we were doing was talking about the kids, or it doesn't matter. You cannot return to those areas, and you cannot contact those students. That is to make sure that every student is being tested and assessed equally. For most lab practical exams, we talked about it, students are going to be required to go into the lecture room and to collect and review lab practical examination cases, kind of determine what they're going to do when they get into the other room. The time to enter the classroom and to pick up the case is we give you about a week prior to all of your lab practicals, so you know the exact time you're supposed to go in. Into that documentation room, you know the time you're supposed to come into the treatment room, and then you know the time you're supposed to go back into that documentation room to write your rationale. Again, those times are to be followed and not gone over. Students are not allowed to bring anything or anyone with them to the lecture room when they pick up their case. In other words, all you can have is a pen or pencil. You cannot bring a phone, you cannot bring a smartwatch, you cannot bring any paper, you can't bring anything. You have to just bring a pen or a pencil and walk into the room. You are not allowed to leave the lecture room after picking up that case under any circumstances. You're also not allowed to leave a testing room once a test is handed out. If you have looked at the test, you cannot leave. I don't care how bad you have to go to the bathroom. I don't care what happens. Once you've seen the test, you may not leave that room. Minus some type of emergency, of course. We're not going to sit there in a fire. You're not allowed to bring anything into the lecture classroom. In other words, backpacks, purses, anything like that. So leave everything in your car except car keys and a pen or pencil. I wouldn't leave it in the hallway either. A lot of times backpacks tend to walk off because people will then go sell those books back to the bookstore. So I definitely would not leave those in a location where they could be taken. You are not allowed to talk to any other students in the lecture room prior to going in there, even to say hello. Nothing. Absolutely no communication is supposed to happen in that room. You're advised to arrive prior to your start time. If you do not enter the room at your start time, and let's say you're 5 or 10 minutes late, you lose 5 or 10 minutes of that time that you were allotted. So if we give you 15 minutes in that room and you're 10 minutes late, then you only get 5 minutes in that room because you still have to come into the lab practical room at the designated time. If you miss this completely, you don't show up and you don't call and tell us beforehand, before the practical start. If you don't call and tell us beforehand, you'll receive a 0 for that lab practical and they will not be made up. All final exams, including the lab practical examinations, which we've already talked, this is the final written, and the final lab practicals must be passed with a 77 or greater. A grade less than 77 or a critical error on an exam will result in the student being placed on probation. You will get, again, one chance to retake this written test, this written final, or the lab practical. If you pass, great. Absolutely nothing happens and you move on. If you do not pass, then you are dismissed from the program, subject to your right of appeal. Again, you will be able to attend classes while you're doing this appeal. You just won't be able to go to clinical rotations. And we'll talk about the appeals process in a little more extensive during orientation. Just like the lab practicals, you are only allowed to fail 2 written exams each semester. Now that's 2 final written exams, not the ones that happen every week. Obviously we don't want you to fail those, but if you do, learn from it, learn what you need to study and move on. The finals are the only ones that you cannot fail 3 of. So normally the program has probably 5 to 7 finals at the end of the semester. You can only fail 2 of those 5 to 7 finals. If you fail a 3rd one, you're dismissed from the program permanently, and you would have to wait until the next year to apply. Same thing for the lab practicals. If you go over that 2 chances for reconsideration, and you happen to fail a 3rd retake, then you are dismissed from the program permanently, and you will have to apply next year with the next cohort to try to get in. Make-up late policy. Normally, we ask that the assignments be turned in at 8:30 the day the assignment's due. If the class begins at 10 that day, then they're turned in at 10. If it begins at 1, then they're turned in at 1. In other words, pretty much when you walk in the room, if you have an assignment due in that class, you need to turn it in. We all understand, of course, that life happens, things happen. So if you're going to be late, or if an assignment, you just didn't have time to get an assignment done, or something happened, you just contact us beforehand, ask us for some time, or something happened, heaven forbid somebody get into an accident, or any of that stuff happens. Again, kids are sick, somebody passes away, any of that stuff we understand. As long as you talk to us, keep us updated and let us know what's going on, we can usually make arrangements where turning in a late assignment won't have a penalty for you. However, if the assignment is more than a week old and you have not talked to us about everything, then you'll receive a 0 for that assignment regardless. However, you also have to turn that assignment in by the end of the semester. If you do not, you will see an incomplete in the course, which means you will not be able to move any further into the program. So all coursework is mandatory. Some of the things that you have to know to be a successful PTA are just covered in homework assignments. Some of them are on tests, some of them are on lab practicals. Therefore, all the information that we ask you to do must be completed, because we do have to show CAPTE, that accrediting body, before, that we talked about on the first or second slide, that we have taught you all the material that they expect you to be taught. Grading of exams or quizzes. You are allowed to grade your own exam or quiz in class. We will basically put everything up and then just give you a red pen, and you're allowed to go through and grade those. We double check everything when you're done, but we really think that this is an extremely beneficial process for students to go through. You guys can hear each other talking and your rationale about why you chose an answer, or why this answer was best, or this one was better than that one, and I think it really deepens your knowledge base to be able to do this. However, I understand that probably all of you are perfectionists. That's probably why you're here, right? Super, super smart. You're the elite. You're very intelligent, and you're used to getting A's. And getting your first C or D, or not getting an answer that you thought you were going to, is very frustrating sometimes. We've had this problem in the past. We've had to do these things in the past. So we have this policy in place. You are allowed to ask questions after we review the exam. However, if you want to receive credit for what we say is a wrong answer, then you must do research from something you have been provided in the program, either a textbook or reference sites or our PowerPoints or something like that, and provide proof that your answer is correct. You can't just say, this is what I thought, or I thought I heard you say, or any of that, right? It's not going to fly. You have to actually back up your answer. Okay, so you got to do the research, do the footwork if you want the credit. You can't even ask for credit until you've done that. So try to restrain yourself when you're upset that you got whatever grade it is that you got. And sometimes you guys are upset when you get a 92. Which I'm not going to dog on you. I would be too. That's how I am as well. But you have to maintain composure, talk politely, talk respectfully, not only when you guys are discussing what is right and what is wrong with the other students, but obviously to your instructors as well. If at any point anybody is disrespectful or starts to demand credit for an answer that they don't back up, you will lose your ability to grade and or ask questions for credit on a test. Of course, you can still ask questions in the program, but we will no longer allow you to sit in there and grade your test and have that feedback session if we can't do it nicely with one another. This has had to happen before. We had one year that we revoked the entire class's ability to ask for credit on an exam on a question that they thought was right. Basically, what we said stood, and we weren't wavering from that test at all. We will respect you, you will respect us, and it will be mutually beneficial relationship, or some of the privileges that you receive in the program will have to be taken away if that's not followed. All right, the student dismissal, again, I told you, was part of the Health Professions Division policy. It is new. The timelines are different. They're shortened and condensed, and who sees the appeal and hears the appeal is also new. It is in your Health Professions Policy and Procedure Manual, which is in that Trajexis system we talked about earlier. You have 3 working days to go get that appeal from the day that you were told that you were dismissed. So there's not a lot of turnaround time. We actually shortened that for the student because you guys want to know that answer. You want to know if you're going to get back in, right? It's stressful sitting there in the appeals process, and we wanted to shorten up that time for you. The cell phone policy. I understand. I'm a mom of a 16-year-old, so the fact that she's driving makes me very nervous. I definitely want to have my phone on because you never know when she's going to be a typical 16-year-old and make a dumb mistake. So I understand needing to have your cell phone where you can see it, where you can check it, that kind of stuff. I don't have any problem with that at all as long as it's not during a test. I do want it off. I don't want it on vibrate. Don't want it on audible, of course. Just needs to be silenced. But I don't have any problem with you looking at it and making sure, hey, whatever call's happening is not something I need to take. If it is something that you feel like you need to take, that's fine too, as long as you're not in a test. Just please stand up and dismiss yourself from the room. So go ahead and just take that call out in the hallway if you think it might be an emergency or something you need to attend to. And then when you're done, just come back into the classroom. Of course, the only time you can't have that is during a test. So you can't have a phone at all during a testing situation. Can't have a phone at all during a lab practical. Of course, we already talked about that. And your CI and patients should never see your cell phone. And I'm pretty strict on that. It is not to be in your pocket. It is not to be taken out when you are in a patient care area ever. If you need to look something up for patient care, then you go into an office or a different space. You go outside. I don't care. So you do not take a phone out and return a text or anything whatsoever in a patient care area. You're there to attend to them. You're not there to text or get on Facebook or Instagram. So, and we'll talk about those clinical policies a little more in the fall semester. Okay, if, heaven forbid, anything happens to you, student sustains an injury during a lab practical, lab practice, clinical education, if you injure a patient during any of those times, got to call me immediately. And of course, if it's something that needs emergency services, 911, any of that stuff, we'll do that. We'll call those people. Your clinical will call those people. But as soon as everybody is safe and everything is taken care of, I'm the first person you call. There are interventions and paperwork and procedures that we have to follow here at the program, of course, and NWACC. So if anything like that happens, I need to be notified immediately. We have only had one infamous student. She'll say she's infamous. She's great. She comes back and tells the students sometimes her story. She did rupture her Achilles tendon playing a game during a class. So we had to call the ambulance for her and go, and she ended up having surgery and, all sorts of stuff. But it's really the only time that I've ever had a student actually injured, in knock on wood, since I've been here. So it does have to be followed for their safety, your safety, making sure that everything's covered and that you're taken care of. So make sure if you are injured, no matter how small you think it is, make sure you let me know that, because we do want to make sure that you're taken care of. Kind of talked about the standards of ethical and legal conduct. Again, those copies of all those standards and values-based behaviors and everything will be in that Trajecsa system when you get there. You'll have several classes where you'll go over all of these. So I'm not going to go into those now, but I would go ahead and start reading that because they are in the summer courses pretty heavily. Your basic principles class covers it in pretty good extension, and so does your documentation and communication. So you might want to go ahead and start looking at those as soon as you get that Trajecsa system set up. Complaints. Surely you won't have any, right? But if you do, of course, you go to the person that you have a complaint with. If you have an issue with another student, please respectfully go to that other student first. See if you guys can solve it. If you can, awesome. If you can't, then one or both of you come to me. Okay? If you don't like what I say, then you can go to the Dean of Health Professions. If you don't like what the Dean says, then you can go to the Vice President of Student Learning. All the way up to the President of the college if you want to. If you have an issue with an instructor, please, again, go to that instructor. Don't go to another instructor. That's not appropriate chain of command. If you have an issue, go to the instructor you have an issue with. If you don't like that instructor's answer, then you need to come to me, program director. If you don't like my answer, again, you can go to the dean, so on and so forth. So there is a chain of command. If you do not follow it, because that will be everybody's first question, have you talked to the student? Have you talked to the instructor? Have you talked to the program director? And then that's what the dean's going to ask. And that's going to be the first question. If you don't follow it, we're going to send you back to follow that process. Okay? Open lab policy. So we said a little while ago that, of course, you have to practice outside of class time. No exceptions. I've never had a student be successful that didn't practice outside of class time. So I think it's definitely something you're going to be doing, which means you're going to be in the lab when no instructors are present, nights and weekends. Under no circumstances are students allowed to utilize any electrical equipment unless faculty are present. So you guys can use the room, you can use the walkers and the stairs and the hospital beds and the plinths and all sorts of stuff, but any piece of equipment that has to be plugged in cannot be used. We have to be present for that. And there are times where we'll come up on evenings and weekends to give you some extra practice time on the things that need to be plugged in during the semesters that we're covering that information, of course, but definitely not without us, okay? So the hours that the building is open will be covered in orientation, but anytime the building is open, you do have access to that room. I'll leave it unlocked for you. I do leave most of the electrical equipment in a locked closet, just so you're not tempted. And if you ever need into that closet for something else that isn't electrical, you can always give me a call. I do give you my cell phone number, and usually I can come up here and open that cabinet if I need to. Just like I talked to you a minute ago, if an injury, of course, occurs, you're training on the steps with crutches and you're practicing with another student and one of you, heaven forbid, falls down the stairs. And I need to know that you fell, okay? Even if you don't think you're injured, if you have something that could have caused an injury, you need to let me know just so we can make sure that you're covered. You have to have 2 students in the room at all times. So in other words, you can't come up here and practice by yourself. There has to be at least 2 people. Of course, that's in case something happens to one of you. We want to make sure that there's somebody else up here that can call 911 or call campus security or anything like that. So you have to have at least 2 people present to be able to come into the lab room. Another reminder for open lab policy: under no circumstances can your family members come up here with you while you're practicing. That includes your children. They cannot be in the lab room, they cannot be in the lecture room, nor can they be unattended in like a student area. We did have a student a couple years ago bring their kids up and set them up with a bunch of coloring books in the student sunroom up here, and then they went in to practice. Absolutely not. You cannot have unattended children at this college. That's a college policy, not a program policy, and so it is followed very strictly. You cannot use any of the equipment to treat an injury that you think you have. You cannot use any of the equipment to treat an injury that you think a fellow student has. And you definitely cannot treat a family member or friend. The equipment is there to practice, to utilize for learning material only. It is not used to be a PT clinic. So you may not do that under any circumstances. Oops. Too fast. Our governing boards. So a couple of information. I've kind of already told you most of this stuff, but here are the actual organization and the website so you can see them. The Arkansas State Board of Physical Therapy, that first one, it's like I said, where you'll find the State Practice Act and the rules and regs. It is also in the Trajexis system. I went ahead and just made a copy of it and put it in there for you, so it was easy. The American Physical Therapy Association, that's the organization that I told you about that kind of governs our practice. It has the standards of ethical conduct on that website, the values-based behaviors, and a lot of great continuing ed and evidence-based practice ideas. It's a really great website to be part of. It does cost money to access everything, but we'll talk about student fees and things like that to join that organization if you want to. As far as education is concerned, remember I talked to you about that CAPTE, Commission on Accreditation in Physical Therapy Education. They govern every single PT and PTA program in the United States. And there are things we are allowed to teach you, and there are things we are not allowed to teach you that happen in the physical therapy field. Remember that this degree is what's considered an entry-level degree, which means there's no way that we could possibly teach you everything that you might do as a therapist for the next 20 years. But we get you ready to have a solid foundation to build on for the rest of your career. It's what every PT and PTA program does in the United States. You're all considered entry-level therapists. There are some things that you will see happen in the clinic when you're in there in clinical internships that are above your pay grade for all intensive purposes. In other words, you say, well, why didn't we learn this or why didn't we learn that? My CI, my clinical instructor, or my physical therapist did this. It's because we're not allowed to teach you those things because they aren't considered entry level by this organization, Commission on Accreditation in Physical Therapy Education. So we are very governed as far as what can and cannot be taught. So I have to follow rules too. It's not just you. I know that's a lot of material. It's usually covered during orientation, but it takes up a lot of time, and it ends up being quite a daunting day, so I'm hoping to remove some of that out of that process. If you have any questions as you are doing this, please make sure you write them down and come into orientation with all of those questions in text so I can clarify anything that you don't understand. I know it's a lot of material. I know it seems like all there are is rules and rules and rules, but I promise we do try to have fun and make it as interesting as we can when you're in an 8-hour day of lecture every day. We definitely like to see and meet all the different personalities. We're all looking forward to seeing the new class and seeing how you guys are. It's certainly fun for us. That's why we do it. It's a lot of work, but it's a lot of entertainment too. And we really enjoy, having new classes start every year. It's just very exciting. So we're looking forward to meeting you. We hope you're looking forward to starting. Like I said, we'll give you our cell phones during orientation. There's some rules on times that you can and can't access. You have to be respectful of our families as well. We have some of us have small children, so we'll give you some rules and regs for that. But we really do want to be here for you. If you have any issues and you keep us updated or in the loop, we can certainly try to work around a lot of things. We've had a lot of students have everything happen to them while they're here. They've had babies and had deaths and had divorces and had marriages and you name it. Life doesn't stop just because you're in the program. We know that. Ours doesn't either. So we really do try to work with our students because our main concern is that you get out and that you are a successful, safe, intelligent PTA. Assuming that's your goal as well. So since we're all working for the same goal, if we all work at it together, it goes much more smoothly. So if you have any questions, please write them down, and I will ask for a question and answer period when we get to orientation. All right, thanks. Have a good day.